Hello guys, welcome to episode 5 of the Great Paediatric Bake Off, and today's theme is climate change, and joining me I've got Liz and Katy. So guys, why don't you introduce yourselves first and tell me who you are and what you do.
So I'm Liz Marder. I am treasurer at the RCPCH, but my other job is I'm a paediatrician in community and neurodisability in Nottingham.
Welcome. And Katy?
Hi, I'm Katy. I have a much more minor role in RCPCH as the co-chair of one of the work streams for its climate change sort of working group. And my main job at the moment is a paediatric registrar on the PEM Grid programme, and I'm in Leeds doing PICU.
Welcome. So today we're going to try and do a sustainable sort of bake, because our theme is climate change, which was quite a hard task for me, but I feel like I've got the challenge and I've risen to it. So I think we're going to try and do some apple crumble cake. So I'm just going to check if you've got everything first. So we're going to try and not use any mixers. We will need an oven though, sadly. So if you can put, have you guys put your oven on already?
No.
Excellent. So put your oven on. Yeah, gas mark 4 or 180 degrees if you've got fan.
Yeah. So I'm gonna shout straight away here from a climate perspective. We all preheat our ovens way too much. Does anyone in this little call know how long it takes your oven to get to temperature?
I don't know the answer, but my oven instructions say I don't need to preheat.
Exactly. So if you have a modern oven, they get to temperature in about 4 minutes, and we all preheat our ovens before we even start baking our cakes. So I'm going to not preheat my oven from a climate change perspective. And it's just another really quick win. If you have an old oven, this doesn't apply. If you've got quite a new appliance, it's just worth knowing that, because I think we're all in that habit of preheating. And actually, maybe we don't need to as much as we previously thought. So I'm gonna give it a go, and we'll see if I'm foisted by my own petard later.
That's good to know. I didn't even know that. So
yeah,
my first top tip of the day.
Yeah.
Excellent. So how did you guys get your ingredients today?
My apples I sourced from my neighbour who lives about 3 doors down, and they have a large garden with lots of apple trees. My flour, vegan equivalent of butter and sugar, all come from, we're very fortunate, they're just a mile away and opposite a large store that starts with S, but other stores are available. We've got a small sustainable organic supermarket, so I tend to try and buy my ingredients there, and I only go into the big shop opposite if I can't get it.
And I'm also at the moment camping at my parents' house, as I've completed my move to Leeds from London, and housing is a challenge to buy. So my mum has an apple tree in her garden, so that's where my apples are from. And my vegan butter I also purchased from said shop beginning with S, but I had other options. And then I try and buy my kind of dried stuff from a refill store, so there's no plastic associated. So my flour, my sugar came from, and my spices for this recipe came from there. And I've elected, I think later you said we could have a crunchy topping. So I've got hazelnuts, which are also from that store, but British hazelnuts, because they're a crop that we have in the UK. So that's why I went for that nut.
You two have done way better than me. So my apples, luckily one of my consultants, Suzanne, she gave me a whole bag of apples, about 30. So I've been baking with those for the last couple of weeks. So very kindly, she has given me some of those. And actually, since I've done that, more people from work have actually given me more fruits. So I've got some plums, some grapes, which is great. So I'm having a great time. I'm doing loads of fruit cakes at the moment. And then the vegan butter, I have got vegan butter, which is good, plant-based. I got that from my local supermarket, but I did cycle there. So that's that's my win for that one. And then actually, because I do so much baking, I actually try to bulk buy, which I think is a good thing to do.
Personally.
Oh, definitely. So I tend to get, like, instead of like the 1.5 kilo sort of flour bags, I tend to get the 5 or 10k sort of ones because I do so much. And actually it probably works out cheaper for me, but also means I go less to the shops, and also it lasts me longer as well. So that's great to hear. So I've got 2 apples. I don't know how many apples you guys have got. It's up to you. 2 or 3?
I've got 3, but
Whatever you
I
want.
got 4 because it's a bit of a piccolo apple situation.
I've got another 10 behind me, so if I need to. So then I've got self-raising flour.
Yes.
Yeah.
225 grams.
Yeah.
Correct. And then I've got the plant-based butter.
Yeah.
115 grams.
Yeah.
I've got light brown sugar.
Yeah.
115 grams. A bit of cinnamon, a bit of nutmeg or mixed spice, a bit of salt. I've got some oat milk in the fridge, which I will use as my milk. I've got a tin, but it's not. It's a silicone tin, which I'm loving actually. It comes out so easily.
Yeah.
It's great. You don't have to grease this, which is good for me. It just comes out, which is perfect. So I've got one of those, which is 10-inch, but 9-inch, 8-inch, whatever you want. And then yes, if you want a topping on top, then you can put some sugar on it, or I'm going to put some pistachio on mine because I'm obsessed with pistachios.
Jolly good. I've got pistachios as well. I wasn't sure what form they need to be in. Maybe you need to chop them or whatever.
Yeah, so chop them or grind them, whatever you want. I like a sprinkle. But you can have them whole if you want. It doesn't really matter.
Yeah.
Cool. So,
and just on that like bakeware theme, so if you don't have silicone stuff, again, it's just thinking a little bit about whether the recipes are right. Most cakes don't need you to grease and line them. It's totally fine just to grease a normal tin, unless you've got your like grandmother's bakeware, which might need a liner. And if you do have your grandmother's bakeware and you're using a liner, you can get kind of liners that you can use over and over again. Because unfortunately, almost all greaseproof paper or baking parchment isn't recyclable in any way because of the way it's treated. Although I did notice in the refill shop that I was in that there is one type now that you can recycle. But it's just thinking about those things. And if you're making like a chiffon cake, you're going to need to have a lining probably, but like this sort of cake, like your average sponge, doesn't really need one, even if you're in a normal tin. So just whack a bit of grease around the side.
Yeah, I like to grease as opposed to be honest, I find the baking paper really difficult to like put into the tin. So why give myself that stress and actually just grease it instead, and it will come out fine, as long as you cool it well, is what I think. So first things first is to sift the flour and the spices and the salt into a bowl. So just so the flour, and then pinch of cinnamon, pinch of nutmeg, and a pinch of salt into a bowl. Just sift it in. I like to sift it because it makes it a bit lighter. So you guys are obviously both in the climate change working group at the college.
Yeah. So
I think quite a lot of people won't know, but why do you think climate change is important for us at the moment?
I got involved in the climate change working group because I was already very passionate about climate change and its impact. And I sort of realised that I spent my whole life looking after children and trying to keep them healthy. And the evidence was ever mounting that actually to do that, I really had to think about the future generations of children and how climate change was going to impact them. And when the Lancet came out with its big report that said this was the biggest sort of threat to health for our foreseeable future, kind of realized that maybe I needed to stop just recycling and doing stuff for myself and trying to keep myself green, and think about a bit more broadly how I was going to take that professionally. And so that's kind of why I got involved and why I think it's important, because actually there's no point us fixing up kids now if the kids of the future are going to face unsurmountable problems that no amount of NHS care is going to solve. If people are flooded every year and then that's followed by a heat wave where there's no water, the impacts on health are going to be way sort of exponentially worse than we're imagining. So that's why I think it's important.
And Liz, why do you think it's important for like paediatricians?
You know, children are much more vulnerable to climate change than others by their anatomy, their physiology, the place they have in society. You know, we launched our toolkit to start talking about inequalities and poverty and things like that, and the link with that as well is really, really important. Particularly, we've all worked with children with respiratory illness, and the link with air pollution and things, you know, is undeniable. So I think it's particularly important for paediatricians because of all those things, but also obviously the children are our future. You know, or me, perhaps not you two, I'm not going to be seeing the biggest effects of climate change in my personal life. I will, but obviously seeing huge effects, but the biggest effects are going to be future generations, and we owe it to them.
Yeah, agreed. I think, yeah, it's for our children. They're going to be the workforce of the future, the population of the future, and I think it's going to impact them probably the most, as well as me and Katie probably, and maybe even your generation as well.
Yeah, I mean, it's impacting us now, but you know, the bigger impacts will be, you know, further down the line. And as Katie says, you know, we spend our lives trying to improve their health in other ways, but actually the most fundamental way we can probably improve their futures is this.
Yeah. Agree. Do you want to rub some butter into your flour?
Right.
Yeah. Well, I'm gonna.
So basically rub it in to make it into sort of like breadcrumbs. So I've chopped mine a little bit and then, gonna pop it into my bowl.
I can really understand why these TV chefs have it all pre-prepared. It's much easier when you, like, I've already chopped up the butter. Or my non-butter.
This is not my first time.
Yeah.
So what do you guys do in the climate change working group at the college?
So we've got 80 members involved, so you know it's a big programme, and we are led by the incredible Alison Firth, who's our project manager, and she keeps us all in shape. So we have an oversight group which includes the chairs of all the working groups, plus Alison and myself. Camilla is on the group. We've got representatives from the trust board, and we kind of look at the whole programme and see that we're keeping to task. And then underneath that, we have all the working groups, one of which Katie's co-chairing. And then because of the work, the college is a member of the UK Health Alliance on Climate Change, UK HACT. So I'm the executive of that on behalf of the college. So it's an organisation of member organisations, basically. And most health organisations are on it. So I'm on the organisation of that. So that gets me involved with lots of other little bits and pieces that I've been involved in.
And my role is much smaller. I hate being the junior doctor. Liz does way more cool stuff. So I, as I always think that about consultants. I've just got to hurry up and CCT. Yeah, exactly. So I co-chair, as Liz said, one of the research arm of the climate change working group. So there are 5 arms. One is to do with the kind of building in the college. One is research. One is advocacy, or is it 4 arms? Maybe I've made an extra arm up. One is membership.
Yeah, well, think about changing them, but currently it's fine.
Yes, at the moment. My sort of role so far is just sort of trying to think about how RCPCH contributes to research in climate change and how we communicate updates to the sort of wider paediatric community, because it's quite a new working group, so about 18 months old. So just sort of trying to wrap our heads around that at the moment. So lots of exciting things in the pipeline. And I think it's really important also just to highlight the sort of RCPCH, along with a couple of the other Royal Colleges, have really like led the way in terms of its commitment to climate change and to making it a really core part of the working model. And it's really impressive. And I think they've just won kind of an award for that. So we're part of a college that really cares. And I think was really inspiring to me as a member.
Yeah. So I think Katie's talking about the climate change scorecard, which was a project which was run by a group of junior doctors, where they asked a number of health organisations, including Royal Colleges, the GMC, the BMA, what they were doing about climate change in all sorts of different domains, and then scored them. And we actually came out top, which was really, really exciting. You know, not to be glum, because, you know, we mustn't be complacent. There is so much more we should be doing. But actually, it is a testament that we're at least going in the right direction.
Yeah, I was really, really, when I saw that tweet come out, had a little like, oh, yes, for us. So, but yes, it's not a competition, obviously, and everyone should just competition.
But what's really
doing the best.
Having done that, a lot of people have been ringing up Alison and said, you know, oh, well, how did you do it? How did you get embedded in, you know, you get it embedded in your strategy, which in fact it is. How did you, you know, have you got any advice for us about what we should and shouldn't do? So it's been really good.
Yeah.
We're setting the example and leading the way, so that's good.
And I do think we've got the moral high ground here, haven't we? You know, it's the children that matter. So I think we should be leading it. Yeah. Yeah,
great. And so have you guys got sort of like long-term goals or short-term goals that you want to try and achieve, or?
So there's an action plan which is for running for 3 years. So we've just finished the first year and we've published the action plan. If you look on the college website, the climate change pages, the information is all there. For me, the next step, and I guess this links most in my role as treasurer and actually being concerned about the college and our building, is that we need to do a carbon audit. We'll start off with a carbon audit of our building and what we do in the building, but actually we also need to think about everything else we do, like exams. We fly people around the world to be examiners. You know, our conferences, everything like that. We also need to be thinking about what our carbon footprint actually is as an organisation.
Which I'll be very excited to support Liz in. Yeah. And I think just for my little bit in the research stream, our kind of next big challenge is figuring out how to contribute to primary research in this area and what role sort of clinicians, because most of our membership are clinicians, can have in that, and why that's important, and how to sort of configure that. And I'm learning all along this process just how difficult or how many challenges exist outside the ones I'm used to in a kind of clinical environment, and trying to get lots of big organizations talking to each other and not reproducing and getting into sort of competition mode, so that, because that's hugely unsustainable. So, you know, actually, how can we start to think about even new ways of working in a research sphere which is much more collaborative and much less about kind of just trying to get your paper in the journal, so not caring that you're squashing other people along the way. So that's something we're kind of looking towards and focusing on, and thinking how can RCPCH support and how can clinicians support, because lots of these projects in climate health don't have any clinicians involved, because we are not doing that research. We're busy trying to keep our healthcare systems together. But it's about sort of like, how can people contribute in small ways to these kind of big projects? So that's kind of where our hope for next year is. And then sort of also a really big push towards communicating it with our members.
Sounds exciting. And it's interesting when you start thinking about it and what we do as a college and the events that we have, or, you know, you were talking about exams and things and like our conference, and actually you realize that it's almost like posing that question, how can we be more environmentally friendly for everything that we're doing?
Yeah.
You know, so like, for example, voting on not using paper ballots and those sort of things. Yeah. Very simple things, but actually quite important, and probably things that we haven't been doing for years before, and now we've suddenly changed. And actually it's made our life easier as well, but it's also environmentally friendly, which is great to see.
Yeah, and that's, you know, archives, which is sort of our college's research update, is no longer paper by default. That was a really big thing, and that's really amazing. And I also saw this week on Twitter that Milestones have started asking, actually, do you want your update as an email rather than sent to you? Because you have to think, paper is not, you know, it's not the worst thing. You know, using paper, yes, we're cutting down trees. It's not terrible, but it's got to be got from where it's produced using carbon, because in a car or a van to the Royal Mail to then dispatch to you, So it's just little tiny things, and the fact that the RCPCH keeps thinking of all of these little ways is just a real model for how to then do it in your own life and in your professional sphere as well.
I think there's a lot of leaders. So, things like, say at conference, we give people we use milks that are more sustainable or something. Just in doing so, you might just introduce somebody. I was introduced to oat milk for that reason, and actually, I changed to it because I like it better. And so, you might just make little changes to people, but then every time I, buy oat milk, I then think more about what else I could be doing, and it's, it's kind of building on just little things and making people think more.
Agreed. I think when I spoke to you guys a bit before this Bake Off, you really made me think about what I do in my life and actually what I can do better. And I think we can always do better, and there's always things that we can change and tweak. So yeah, I think once you start thinking about it in more detail, you were just talking about the post, and I was like, oh yeah, that entire process that I don't think about because it just appears on my doorstep. And actually, why don't they just send me an email or something? You know what I mean? Yeah.
And yeah, it's just about little tweaks, because I think one of the big things in climate change and in sort of our dealings with young people is how this is affecting their mental health, and many young people are quite worried about this, and whether that's an appropriate level of worry, or actually some children are becoming quite unwell with this as one of their anxiety things. It's about just bringing it back to, it's just about making little changes, and if everyone makes little changes, we probably all be, the world would be fine. So don't get bogged down in trying to, not exist, because, that's not an option, and you're making a positive contribution to the planet. And it's just about making sure your net is positive by just doing tiny little things that don't really even impact you, that are positive for the planet, like saying, I'll get my milestones in an email, that's fine for me, I'll still skim through it, no problem. Or, I'm gonna get on my bike to get to work because actually I was taking a car, and I've just looked and it would be quicker for me to cycle anyway, which for lots of people who live in cities is true.
You've hit it on the nail there, Katie. That's something that I did, and that's a massive, I only worked 4 miles from work, and I was driving in, but that's because I couldn't cycle at the time. And now I cycle, and now I've learned to cycle, and now I cycle to work. I'm still managing to do it, even in sort of the autumn weather, which I thought I was never going to be able to do. So
amazing.
And I save, I've helped the environment. I save myself some money on parking. And the best thing is I kind of enjoy it because it's refreshing. It gives me a mental break. I like the fresh air, and yeah, it
also saves you time. You come home and you've already done your exercise. You don't.
Yeah, exactly. And I always get home at the same time. So whatever time I leave work, I know that I'm going to be home in 25 minutes, regardless of whatever is on the roads, because I can weave through it all. So it's great.
Yeah. And I think it's lots of the things are just about finding the wins, like the win-win situation. So there's so many things there that Ash, that you were saying, that are really kind of positive in so many spheres of your life. And actually there's quite a few things that people can do that it might start feeling like, oh, I'm going to do this as a sacrifice. I'm going to cycle. I'm not going to use my car. And then actually you realize this is not a sacrifice. This has really enriched my life.
I've got the apples.
Right.
Okay.
So do you want to peel them and core them and then cut them into little bits, essentially?
Yeah.
1 centimetre cube.
In my composter.
What's
you say you're putting them in the composters?
Yeah.
Very well.
Just started composting. I'm a novice.
I've had discussions in sort of my department about what we can do as colleagues and as a department or nephrology department to be better and have an impact on climate change. But sometimes they don't really go anywhere, like those discussions that I've had. And then it's kind of like an idea, and then nothing ever materializes from it. So is there anything that you guys can think of that general paediatric departments could get involved in to help with climate change? I'm intrigued to know.
Yeah. So I think the first thing to realise about this is that the NHS has made quite significant commitments to sustainability. It's quite, it's a good organisation to be in if you care about this, and that all trusts now have to have a green plan, and that green plan will have a leader, and that might be a project manager, it might be a clinician, it depends on how your hospital's set up. But I think starting by asking them what help they need and what's going on is actually a really, having learned the hard way, probably quite a good way to start, because then you can take that back to your department and have some trust backing to so that you make those conversations go somewhere other than a conversation. But also to realize that conversations are still really important for like those reasons that we were saying earlier, that it just makes people think about the actions that they are taking. Because obviously Liz and Ash and I probably care about this and have been thinking about it for a bit. And some people just aren't there at all. So the fact that you're having those conversations in your department is actually really powerful in itself. I think from now having worked in a few different trusts, think with this sort of hat on, one of the big things to think about from a clinical perspective is PPE use, which was difficult in COVID, because obviously the initial messaging around that was very much we had to wear gloves and aprons and masks and visors. But it has now, the advice pretty much from, well, certainly the national level advice is that we should be in pre-COVID PPE. And what does that look like? Because I think lots of us have got very good at wearing gloves and aprons for tasks that don't need them and that there's no evidence for. And just there's a really, really good piece of assistance called the Gloves Off campaign, which was run by Great Ormond Street originally, but they're very willing to share their resources. And it's just basically an education piece to get people to think about why they're wearing gloves and when's appropriate. Because you can really quite nicely, just by going and asking the person who purchases the gloves for your department, how many boxes of gloves you use. And then you can do these kind of promotional pieces about when to use them. And then a month or so later, you can ask the same question and see if they've managed to reduce their ordering. And so it's quite a neat little thing. But it also makes a big difference. So at Great Ormond Street, they saved something astronomical, like 20,000 tons of plastic.
Wow.
And it was very robust run project. But I've really pleasingly, as I arrived in this new PICU, I've not worked in Leeds before, and they've just finished running their kind of first iteration of their Gloves Off. Because obviously intensive care environments, often a lot of PPE going on, and so they've sort of looked at what was necessary. And I think that's a really good project for people to get involved in, because trusts are quite on board with that, because gloves cost stuff, it costs money.
Yeah.
So it's a good way to reduce from that perspective. So it's again thinking about those dual wins, and also it's a project that's really well mapped out, so you know what steps you need to take. And so I think that's quite a good one that I'd recommend.
Yeah, I think that's really important, is persuading people who perhaps haven't got climate change as their biggest priority, that actually most things that we would do for climate change are going to save money, make everything more efficient, and probably good for people's health as well. So it's pointing all those things out. So definitely engage with who's ever leading in your organisation, but also each integrated care system, or what they're called now, also has to have a green plan. So try and engage in those things. They're always looking for people to support. I think the other thing is, you can do everything we've already talked about. So in your department, think about your meetings, think about whether you need to travel for them or they need to be online, think about your paper usage, think about your recycling. Turn appliances off at night, turn lights off, just the simple day-to-day things that we should all be doing.
Yeah,
I think we often forget to do them at work.
Yeah.
So I work in a child development centre, and I'm usually the last person to leave in the evening, and I sometimes turn off 30 or 40 different lights. People just don't think about it. It's just so it's those sort of things. But then of course the other important thing is the clinical pathways, and each different department will have different clinical pathways they can look at. So for the respiratory team, it's inhaler use, it's medication use for all of us. But I guess for the renal teams, it's probably water use, isn't it? And the vast amounts of water that you use. for myself as a community paediatrician, it's travel. You know, what we're going out to, what we're expecting people come in for. Can we plan our routes differently? Can we travel differently when we have to travel? All those sorts of things. So yeah. Are we supposed to be chopping? Have apples chopped? Sorry, I got distracted.
Yes, I've chopped my apples.
Chopped, yeah.
And then you can mix them with the brown sugar into another bowl or into the same bowl as the flour. Well, I've done it in another bowl and I'm going to add it.
Again, I get lots of my like baking sustainability from a chef called Anna Jones, who actually has a book called One Pot, One Plant, One Planet. And I hadn't thought of any of these things until I read that book. But it's about thinking about where energy and resources are used everywhere. So the smallest amount of bowls or pots or pans you can use for anything is better, because otherwise you have to wash up that pot, that pan, that bowl. So it's again, just if you can tweak a recipe so that actually you don't, you know, you are just shoving it all in one bowl and it still tastes good. Sometimes that's worth thinking about. So I'm going to, because when I did a test run, everybody, because I was a bit anxious about this. So when I did the test run, I did it all very separately and it went really well. And I think it will go okay to put it all together. So I'm going to just try. And again, when mine fails because the oven wasn't preheated and everything was in one bowl, you can be like, well, you tried to be too green, you idiot.
I think yours will be better, to be honest. Yeah, I've just looked at how many bowls I used and I feel bad now.
So the sugar and the apples are going in the bowl with the flour and butter.
Yeah, so the sugar and the apples together and then into the flour, or all together if you want.
Yeah.
I like that, Katy, about working from the top down in this organizations, because that's the thing I found most difficult. And I think we recently had like our speciality meeting and it was like, what can we do to be greener in our department? And everyone was like perplexed. And yeah, I totally agree about the PPE. I think we overuse it still. And actually you know, the national guidance is there for a reason. And actually we should be following the national guidance.
Yeah.
I think it's sometimes trickier when you have other departments who are like fighting you, like infection control and things.
Yeah, and sometimes so the reason, and this is again, lots of stuff in climate change and making a difference is about reaching out to people who maybe you don't normally talk to. So often we all grumble about infection control, and you know, I'm very guilty of that. But actually, the Gloves Off campaign at Gosh was was led by one of their infection control nurses. So sometimes you know, having those conversations and making sure you're cross-pollinating and using everybody's perspective is quite important in this work, I'd say. And it's really frustrating for us as trainees because we move so quickly through places. And that's why my first piece of advice was reach out to your green team, because often they'll know something that you can contribute to, but it doesn't have to be all on your shoulders, because it's quite, again, thinking about sustainability, any improvement or any change needs to be sustainable in itself. And if it's all on you, that's really, really difficult. So it's about building a team and working together and working across silos, not just in paediatrics. So Ash, you're a renal guy, right? That's your. So there's some really cool work going on with some of the adult renal units in the country. And it's about, you know, reaching out to them and asking them what they're doing, and then seeing, oh, could I just take a tiny bit of that into our unit? Because sometimes people have had really like off the wall thinking and it's worked, but it you know, having that off the wall thought to start with may have taken years. So don't reinvent the wheel, because there's inefficiency in that as well. So
I agree.
Is really important. So at a medical level, so there's talking to different specialties, as Katy's just mentioned. So yesterday I was chatting to a anaesthetist, and they were talking about anaesthetic gases and what they can do to change them, but then started talking about actually giving less anaesthetics. Now I think as paediatricians, we are people who ask for a lot of anaesthetics for minor procedures, and you know, sometimes they're justified, but you know, are we thinking hard enough? And you know, do we need to think more before we ask the anaesthetist, and do the anaesthetist need to challenge us more about whether we need to use them in the first place? So that hadn't really struck me, never occurred to me before. I thought it was all down to them thinking about the gases they use. On a wider level, you know, if you get involved beyond your trust in the care systems, is actually when you sit down and talk to other people, it's not necessarily the health professionals that are going to give you the most big wins, but it's having people from housing and having people from transport, from the local authority, and town planners and things, that, you know, being able to influence them. And you can do that by getting involved in your systems.
Agreed. Have you managed to mix all your
So
I have.
Excellent. And then I think it's to put some milk into it to make it into like a little bit of a batter.
Okay.
2 to 3 sort of tablespoons, and then mix it together. One of the things that I thought about this week was one of my patients had come in for a scan, an ultrasound scan, the day before the clinic appointment, and then came to the clinic the next day for their blood test and their face. And they were like, oh, yeah, like this, you know, we're happy to do this, but you know, I don't want to miss 2 days off school, or 2 afternoons off school. And I was thinking to myself, why did we not plan this better? Why, you know, why did they not just all come in for one visit? And you know, I've been thinking a lot about that with when, you know, when they're coming in, when patients are coming in for procedures and things. Actually, why don't you just get everything done in one admission? Or, you know, if you need an investigation doing, as opposed to them coming another time, actually why don't you do it when they're in that one day, and it's better for them, and it's better for the environment.
Yeah, absolutely. And I think it was really interesting. I was reading, God, I sound like quite a spot. I was reading the RCPCH's latest statement on the kind of inequalities in healthcare and that impact. And it was one of the things that really struck me was that in that report, the average price for a family of attending an appointment is £50, because there's loss of earnings, there's other children to look after, there's the transport of getting there, there's the parking once you're at the hospital. That's a massive amount of money. And I think it's one of those win-win situations. If you really try and think about how to streamline a patient's care, you save loads of planetary resources, but it's also helping to decrease that inequality, you know, the equality gap. Because a very affluent family will manage to get to 2 different appointments, and they'll put in the extra hours with their child to make sure that they catch up on school, or maybe they go to a good school anyway, so that school will make sure it happens. But when you're talking about someone who perhaps their parents are both working multiple jobs, or they're being looked after by an older sibling, you know, you can suddenly see how that could really vastly change their sort of healthcare experience, and how if we'd managed to make everything happen on the same day, it would actually improve their health outcomes and their education outcomes, and it would be better for the planet, and it would probably cost the hospital less as well. So yeah, I think that's such an important point, Ash.
We've then got people ringing up and saying can they change their appointment to a telephone call because they can't afford the bus fare, which, you know, we've guessed people are now being much more overt about saying it.
Yeah, and as you know, something we need to think of more and more, because the cost of living crisis is very real. So there's now people are battling many things at the same time, and it's just about thinking especially creatively about how to decrease the negative impacts from everything, and that's why some of these things that are good for the planet, and that's why you primarily think of them like a telephone consult, but actually often there's lots of other benefits from having that, as long as you know your family have access to appropriate technology to allow that process.
Yeah, I agree. I think we during COVID, we've obviously realized that so much can be done virtually now.
Yeah.
And we can do telephone consultations. Yeah, but we have to be mindful of those people that have inequalities, that may have difficulty with technology or not the education in it. I think we did a survey of some of our transplant patients, and I think we just, you know, half of them much prefer the virtual setting and the telephone setting, and they much prefer that. Others want to come in face to face and have it all done on one day. So I think we work with them to do that, is what.
Yeah, absolutely. And I think that's a really important part of this kind of trying to think about climate change and health. It's the same as we need to approach all areas of medicine. It's about talking to the patient, because that's what this is like, you know, about what they want and their opinions about it. And then trying to incorporate and work with with what's best for that family. And it's the same when you're trying to make green system changes, or you know, anything that extends beyond your personal life. It's really important that you talk to the people it's going to affect and ask them how they want to come on this journey with you, not do a journey to them. So I think that's a really important point.
Yeah, the other thing is multidisciplinary team working, you know, that obviously in a child development centre we do try and see children together, so if they can come and see me and see the speech and language therapist at the same time, we can complete, you know, for instance, an ASD assessment often in half the time that we would have otherwise, with half the journeys, and it's much richer because we learn from each other and how we do things, so there are benefits in that way as well.
Yeah,
so, you know, using as much joint working as you can too.
If you've mixed it with the milk, you can put it into your tin.
I'm going to switch my oven on now.
You
and
can
I'm going to do the same. I'll be right back.
and then I'm going to put a bit of sugar and a bit of potassium on top of mine.
Yes, so yeah, so we just put it in, smooth it down, sprinkle with the sugar and whatever we're putting on
Yeah,
top.
whatever toppings you want.
I always have tried to do batch cooking just because I only have to clean the kitchen once. But we're making one cake at the moment. I don't know if either of you have got anything else in the oven, but thinking about actually if you're cooking things using the you know, the number of things at the same time.
Yeah, definitely. So at the moment I'm gonna roast some tomatoes at the same time, which I rescued from a sad looking pile at the grocer's, and it's about also thinking about how to minimize food waste. So that's another thing that I do. So I take the kind of moldy vegetables and then slow roast them, or my mum has a dehydrator, so sometimes we dehydrate stuff, and then it's sort of ways of preserving, pickling, and just thinking of it creatively around that. So yeah, my tomatoes that we got yesterday from the waste bin are roasting, and then the cake will go in at the same temperature.
So what will you do with the tomatoes afterwards?
We'd probably just make them into pasta sauce, or but we freeze them sometimes because it depends. My mum works for a food waste charity, or doesn't work, volunteers for a food waste charity. Part of that charity is trying to get food to disadvantaged people for no money, and the other half is just making sure it doesn't go to waste. So they have like a cafe that kind of uses up surplus vegetables and things, and then you pay what you feel you can afford. So some of that works as well for a kind of social equity project, but and then if you've got money, then you pay just as you would if you went to a normal cafe, and then anyone who volunteers for the project can also take anything that is in excess and then use it, and just try and stop it going in the bin, basically, because this is something, the statistic is really scary from a food waste perspective about how much we throw away in this country, and that's after it's left the field. So it's something like I won't say a percentage because I can't remember it, but it's really scary. So anything that you can do to minimize that in your day-to-day activities is really important as well. And there's also, basically most things can be roasted in an oven, and you can have your whole oven on. It can be roasting loads of different things. You can be making your pasta bake for tea, and then your other trays on as well. It's just thinking like, what can I put in that I'm going to rescue, because otherwise I'm going to throw that manky celery away. If you roast celery, it's delicious. So and then you can just shove it through couscous or whatever, later. So
this is what I tell families as well, because a lot of them are, we've got lots of health inequalities within paediatrics in our children. And some of them ask me, I can't, they have to do certain meals, or they've got to soak their potatoes for a few hours before because they can't have the potassium and those sort of things. And they always ask us, they go, how am I going to do this? And like, how it's going to cost me too much. And it's those basic things like batch cooking for the week, or, avoiding food waste. I'm terrible at, sometimes I was awful at one point in my life, and then I've just learned that I've got a freezer. So why am I not making things and freezing it, or freezing things that I know I'm not going to use in the next week or two, and actually letting it defrost in the day while I'm at work, and then coming back, and then I can just cook it.
Yeah, and I think that's a really, see, Ash does this. I'm not sure if he knows that's more sustainable or not. But if you do use your freezer and you do batch cooking, which is definitely the most planet friendly way to cook, it's getting it out of the freezer and leaving it on your side to defrost, not having to get it out of your freezer when you get home, and then putting it in the microwave or whatever, because obviously that's just passive energy, and it's a much greener way to do things. So well done, Ash.
Thanks. I do that with same with butter as well. So you know people will like microwave it to soften it. Actually, I'll just take it out in the morning. I know I'm going to bake later. By the time I get home, it's lovely and soft, easy to can use it straight away.
Yeah.
Have you guys decorated your bakes?
I don't know if decoration is the right word, but I have topped my bake.
Yeah. I decided that I didn't want to crush my pistachios, so I just put them on top.
Love.
So once you're ready, you can put it into the oven for about 45 minutes, and whatever else you would like to bake at the same time, please put in as well.
But I was just amazed. I do little runs around our local area, mainly down canals and down paths that have got blackberries at the side. I mean, I love blackberries, but it's people don't go out and use them. There's families who've got food poverty. Why aren't we teaching them all to go and do those sorts of things and
go and forage? Yeah.
It's a really good point. It's also is about how we've disconnected from nature a lot. So lots of people don't, because they don't realize that that's that the blackberry that grows on the hedgerow is the same as the blackberry that you see in Sainsbury's. They don't make that connection. So, things like elderberries, I don't know if you guys, and they're the berries that come from the elderflower bush. Elderflowers you can forage and make into cordial yourself as well. The elderberries, they look like they grow on a tree, and they look quite like the kind of really poisonous berries, so people don't harvest them, but actually they make like super delicious jam. So and you can eat them as well, but it's just about realizing what's there and around you. Foraging is something that does have to be done with some caution, apart from blackberries and elderflowers, which are quite easy. But there is, like, the UK is full of things you can eat that are growing that no one knows about.
I'm going to try and grow some vegetables for next year, because one of my friends started doing that this year, and I was a bit late to the party, so I was like, I'm going to try and have a little vegetable patch outside and see what I can grow.
And there's really if you're going to do that, actually, again, thinking about what you grow. So one of the things that we waste a lot of is soft herbs and salad in this country, and it saves you loads of money. They're quite expensive things, and they grow quite nicely, actually, in all sorts of different conditions if you buy the right one. So I'd recommend, if you're starting a veggie patch, to think about salads.
So I've got a tiny vegetable patch, but all we grow is and these are really easy things to start with, is petrol spinach, rocket, and loads of herbs. So we're self-sufficient in rocket and coriander, and that's what we eat a lot of. So really,
and they're often things that come from quite far away. Salad is like, it's quite a carbon intensive crop to purchase in the supermarkets, so it's a really good idea, Ash. So
I already grow rosemary and things, and I use that for focaccia and things like that. So I just want to do a little bit more. I think you guys really made me for a more environment. I've loved it, because actually at work it's been so nice that people have brought it. All this produce that they have at home. They've got apple trees, and they've got so many apples, they don't know what to do with them. So actually giving them out and distributing them to all of us so that we can eat them, cook with them, bake with them. And then we've been, I've had loads of stuff, runner beans.
And this is one of the things,
herbs. It's been great.
Yeah, one of the things I recommend sometimes to patients, especially the people who say, well, I'm on a difficult budget and I can't really afford to buy fruit and veg and I don't know how to keep my kids' diets healthy, there's lots and lots of sort of community-based apps. The biggest one is something called Olio, but that essentially connects people that have surplus with people who want. So sometimes it is things like, I don't know, I'm sure many of us are guilty of kind of going, we bought a packet of parsley or coriander or something, but we only wanted a few sprigs. And then it just sort of goes manky in the bottom of your fridge if you're not quite mindful about how you cook and making sure you have another recipe for it. And the whole point of Olio is that then you just put your half-used packet on and then someone comes and collects it. And people do that directly from the supermarkets as well. So people are super Olio users. They go to their Tesco's Extra or their Sainsbury's Local or whatever, and they take big bulks of like baked goods and fruit and veg and stuff. And then you just sort of contact them and say, you know, I'd really like that bag of carrots. And it's all free. And so it's quite a good thing to recommend for people who maybe, it's for everyone because it reduces food waste, but specifically for people who maybe are struggling a little bit more to buy fresh fruit and veg. So it's quite a good thing to know about. And there are a few different ones. Olio is just the biggest.
Yeah, the thing is, I really need to explore this, and I can't claim I've done any of this, but you know, it's community gardens and things like that. So we've got a bit of green space next to our tram line, so it's somewhere where people walk all the time. It's a nice footpath. It's right next to one of the big GPs, and they've just put a few raised beds there. And the idea is that you can just come and take. You know, I think we ought to be doing far more of that sort of thing.
Yeah, definitely. And some trusts are really good at that, and it's worth, again, like, this is why I say ask your green team, because you know, I've come from London. Most of those trusts have no green space, and it's a big issue, and they're one that lots of them are trying to address. I'm now in Leeds, and their estate has much more green space, and actually they have like a little veg patch, which is kind of for patients and staff, and there's, you know, for longer stay patients and staff to do, and it's just about asking, you know, getting involved with stuff like that. And there's lots of more community-based stuff where it really is big community projects, big community allotments, and then the crops grown are given to places that need them most, and to families who are maybe struggling. And it's just thinking of outside that box of, I'm a doctor and I work in fixing a person, and thinking about, I'm a doctor and I have a role in society and society's health as a whole, and thinking about what that looks like. You've
just got me thinking. So our child development centre is on a hospital, on a sort of a campus. I think it's meant to be one of the biggest spaces that a hospital in the country. We've got loads of green space, and I'm just sitting here thinking, God, what, you know, I'm talking about all these things elsewhere. Why haven't we got a garden at the back of the CDC? People could go out their lunchtime, instead of, you know, sitting in the staff room. They could go out and enjoy a little bit, water the garden, do a bit of weeding.
Yeah.
Then we could give the produce to whoever wants to take it home.
Yeah.
I think that's my take-home message from today. So if any of my colleagues are listening, I'll be on about this next. We've got loads of space.
I think
that sounds amazing.
Yeah, I'm gonna find who my green team is in my trust, and I think we should, you know, we've got lots of champions for lots of other things, LTFT, and, you know, within our departments and those sort of things, but actually we should have a green champion within our department, somebody who's consciously thinking about these things and actually making us more aware and seeing what we can do as a little team to make things a little bit better. I don't know if you've got any more top tips for anybody, Katy.
No, I was going to say the same. So well done, Ash.
I'm so proud of myself.
No. I think it's really important, and also just to realise that it really is just we're at the point where the conversations are just really, really vital, and continuing to have them, and to never think that because you have knowledge about something, other people have it too. Which I think is the thing that I've struggled the most with. Is I'm an A&E doctor. I like fixing things very quickly, and if I can't fix them, I like to give them to someone else. And that isn't how this problem's going to work. I can't fix it. I can't just give it to someone else. I have to keep just beavering at it and keep just passing on the knowledge that I have to other people, and hoping that, you know, that spreads some seeds and that there's this slow build-up of change. And the fact that an NHS, like that we work in organizations that now have sustainability teams, is such progress. And that's only because many people for many years have been saying these things, and we just need to keep promoting them and keep making really small changes. And having someone kind of embedded in your kind of departmental structure that's thinking about that is really a really key way to do it, to just make sure it's always thought about. And one of the things that I saw in one of the trusts was that they've made it on their audit forms, on their, you know, how everyone who does an audit, we have to register it at the trust and blah, blah, is actually one of the questions they ask. And that's using the sustainable QI kind of frameworks of, it needs to have a benefit to patients, it needs to have a cost benefit financially, and it also needs to be sustainable, and to have a cost benefit from a carbon perspective. And they've embedded that on their form, so it just makes someone think about it every single time to steal things like that.
But just not just on an audit form, you know, when we put in a new policy, when you put in a guideline, when you put in a paper for the board, when you put in a you know, person specification, we always have to put at the end of it the equality impact assessment and everything like that. We need to have a sustainability impact assessment, and I think that's something we could probably, you know, not necessarily us as a college, but the colleges, the wider colleges and the UK HAC, is to write a specification about what goes into that. I think that'd be really useful. So absolutely everything has it in it.
Then we'll still stay on the top the next time they do
well,
that.
Maybe. I suspect we've thrown down the gauntlet on that. But it would be nice to see that other people are doing better because they've tried.
Yeah, absolutely. And there's also, in thinking about the green space thing, and if you work in trusts where you think, oh, there's lots of land, there's something called the NHS forest, which is worth investigating as well. And that's the idea sort of behind that, is that planting trees is a way of carbon capture and offsetting, and trying to find sort of team spaces where you can do that. And that may not actually be on your site, but it may be something your hospital wants to be involved in. Again, it's difficult if you work in a London hospital because nowhere has any space, but outside of London, that's a really nice thing to be involved in as well.
Yeah, greener prescribing, that's the other thing I remembered.
Oh yeah, that was me.
So I know RC Psych are really looking at, you know, how you can bring nature into people's lives as part of their therapeutic process, particularly for adolescents. Actually, I think there's been some stuff on the social media about it this week from one of their conferences.
Yeah, I think there has. Looking at any of this, it's really sometimes a bit demoralizing if you're a junior doctor, because all of this big system stuff that sort of Liz was talking about, often it does feel a little bit untangible to us because we've moved so fast, and sometimes it's very hard to embed yourself in that, or even understand the system you're in before it's time to leave for the next system. That's why as a junior, your conversation pieces are so important, and keeping this in your consultant's mind and whenever there is a manager there, kind of just mentioning stuff to them, because probably they're the people who understand the system more and where the impact will be. That's still really important. Your voice is still really important in that. Thinking about kind of smaller things and things that you actually do as a clinician, prescribing is probably the biggest place you can make a difference. And thinking about how to prescribe efficiently and effectively can have really quite marked differences on sort of carbon footprints and on environmental kind of outputs. So we all know that we should be really mindful about antibiotic prescribing from a resistance point of view. There's ever increasing evidence that we don't need the lengths and duration of antibiotics that we're using for children. So, and it's about really engaging with, what does our hospital say we should treat pneumonia with? Is it 3, 5 or 7 days? Because there's now quite robust clinical evidence that 3 days is almost certainly fine. So why are we still giving 7? Because pediatricians are really bad at this. GPs are so much better. Because the GP, and it's to do with the patient spectrum we see. So we see some sicker patients. So we feel very uncomfortable going down to 3 days. But if you're prescribing acutely in A&E as a paediatrician, you probably don't have a super sick patient, and you're going to safety net them. You go so if at 3 days they're still sick, they'll go to their GP or they'll come back. So don't over prescribe your antibiotic, because antibiotics leak into the water systems. They cause massive issues from a kind of actual ecosystem point of view. But you also, they have to be produced. They have to be put in big bottles. So everything, if you can minimize the amount you're using, is going to have a sustainable impact. And then the other thing, which I actually think paediatricians are really good at doing, and probably we all do, and maybe our GP colleagues are a little bit less good, is thinking about dosages. So if I don't ever prescribe 1, 2, 5 and 5 mils of amoxicillin, I think it's a useless preparation of medication. I always prescribe 250 milligrams or 500 milligrams in 5 mils, and just make the child take the smallest amount of medication you can. Like, all parents will thank you for that. All children will thank you for that. Unless you're giving oral amoxicillin to a 3-month-old, in which case I think we need some other discussions. You know, it's probably they could cope with a bigger dosage. And it's thinking about that across all the ways you prescribe. Are you prescribing the smallest amount, like the biggest amount in the smallest volume? And the other thing to think about is encouraging your patients to take tablet medication rather than syrup. And having those conversations, you know, it's like making every moment count. So if in your A&E, you're like asking a 9-year-old, oh, do you take, are you okay with tablet Calpol, or do you need Calpol, or paracetamol, or whatever? And if they say, I need syrup, that's fine. You don't approach it then, it's an A&E, but you say to the mum, oh, there's this really amazing website called Kids Meds, which helps kids take tablets. It's going to be so much easier for you. And you know what? It's better for the environment as well. And that's all you need to say.
It's so much cheaper. So, you know, if you need a bit of money to help you set up a project, you're going to win on it. You know, we had a particular case which actually changed the way we prescribe melatonin completely. Is that, you know, melatonin liquid is really, really, really expensive compared with the tablets. And I had a very, very, very large child who, you know, a large adult sized child who was having volumes of the stuff.
And the tablet's like this big.
Yeah, and the tablet's like this big, but you know, it had to be pink medicine because of his diagnoses and everything. But actually, it changed out when the pharmacy rang me up and said you're spending £600 on liquid, which could be, you know, a month or whatever it was, which could be £25 in tablets. You know, that really changed the way we thought about it all.
Yeah, and I think that's a really important point. Yeah, because liquids are so expensive. So it's not just the carbon. Again, it's that win-win. So
but you take you know, please, can we have a little bit of money to set up this project, and this is how much it's going to save you. Yeah,
exactly. And the other big thing from a prescribing point of view is about our inhalers, which I think we all, certainly in acute settings, but I think lots of kids in chronic settings as well are on inhalers. It's thinking about when they're old enough and when they're capable of not taking a metered dose inhaler anymore. So that's probably about 12 for some kids, that might be 10. And then it's about making sure preventer therapy is again in the highest dose for the smallest amount of puffs. So if you have someone on Clinell and they're taking 2 puffs of 100 mics, they could take 1 puff of the 200 mics, and that halves the carbon footprint. And metered dose inhalers have a really, really high carbon footprint. So anything we can do to try and reduce use is really important. And even using that as a motivator for patients and parents to take their inhalers correctly is important. So if you say to someone, if you took your inhaler with your spacer, you're going to have to use lots less of the medicine because it works better. And did you know this medicine is quite bad for the planet? So if we can get you to take less of it and your asthma actually gets better because you're using it properly, isn't that such a good thing for both you and for the planet? Because this is quite a powerful motivator for young people. You have to be careful with your phrasing because you mustn't make them feel guilty that they're taking medication. It's just about just really thinking about how you phrase that with your patients, and that's another really good way of decreasing carbon footprint.
I've definitely changed my prescribing since you two made me aware of it. So now I ask the nurses generally, because they're the ones that will tell me how many vials I'm going to use of this if I prescribe it like this. And you're so right about the antibiotics. You know, we give a 7-day course, and it means that they have to have 2 bottles of the 12531, and they will only use like 5 or 10 mils out of that second bottle, and the rest of it just goes to waste. And why don't you just give them the smallest, the higher suspension with a smaller volume? And we've been doing it with my vitamin D and things. We know I use loads of that in renal.
Yeah.
And actually, you know, they're having 10,000 units a day of cholecalciferol, but actually, why don't they just have the 50,000 units once a week? It's so much less.
Yeah.
And then it means they have to take it less. They're going to probably comply with it better. So yeah, I think getting your nurses and getting your pharmacists involved, and then making me consciously think about what I'm prescribing. And now I'm very particular, and I will write the suspension or the tablet that I want. So whatever concentration I want it in, as opposed to leaving it to ambiguity, because on the prescription, because actually I'll be like, no, I want this one because this is going to give them, it's going to last them the longest, and actually they're going to use the least amount of it. So yeah.
And I think just about what you were saying, Ash, about being specific about your prescription, just made me think. I think most trusts now are on board with this, but if you know that your trust is still using GSK branded salbutamol, so that's Ventolin, there are multiple case studies all over the country of how CCGs have said we are no longer using Ventolin because it's 5 or 10 times worse than generic salbutamol from a carbon footprint perspective. So if you see anyone with Ventolin inhalers, and ask them where they've got them from. If it's a GP, just send an email to that GP and say, you're still prescribing this.
Yeah.
Do you know that it's probably costing you more?
Yeah.
And it's so bad for the planet.
Yeah.
And if it's come from within your hospital, and then get in touch with me, and I'll put you in touch with some pharmacists who have made sure that these are off CCG prescribing formularies. And we have to, so people, no matter even if Ventolin becomes super cheap, yeah, CCGs aren't allowed to buy it.
Great at this. I mean, I'm ashamed to say that I was using a GSK salbutamol inhaler until I started probably with this work. Became aware of it, and I contacted my GP because I happened to have a review, and they said, oh yeah, no, you're already on the greenest inhalers, because I think I was on the more strongest. They went through everything, and I looked them up, and I certainly wasn't. So I rang again, and they said, oh, the pharmacist will help you. And you know, they were fabulous. They gave me 6 different options of what I could try with different ways, what the carbon footprint was. They sent me the videos of how to take them. So, you know, there are other people who are often better at doing this than we are. A prescribing pharmacist in a general practice probably is a really good person to start with.
Yeah, agreed. Less waste. I go through, my patients are a lot of them are chronic, and they're on like medication lists like this big, and every time now in clinic, every time I go through them exactly with them and go, first of all, are you still taking this? Are you, if you're not complying with it, there's no point in even prescribing in the first place. And then I'll look at it and I'll say, is it a tablet? Is it a liquid? Is it a capsule? How can I make this easier for you if you're struggling with it? It takes, an extra couple of minutes, but I think that's worth it.
Yeah, that's a really amazing example of good practice. Deprescribing is one of the most powerful ways we can decrease.
Because it just goes on to their repeat prescriptions from the GP, and it will just keep on coming until you actually change it from the top end almost. Yeah.
And also, there's sometimes if you don't have time to do that in your busy setting, like, or you're struggling with your clinics and it's already 45 minutes late, and you can also empower patients with that information. So you can just say to patients, I'm so sorry we haven't had time to go through your list properly today, but if there's things you're not taking, please don't collect them from the pharmacy. Don't tick them on that prescription repeat. because it's really bad for the NHS, it's really bad for the climate, and it's useless to you. So it just even if you don't have time to do the thorough job that Ash has done, sometimes again, just patients don't know. They can't change behaviour if they don't know there's a problem with that behaviour. And for some people, telling them that it's expensive for the NHS, well, they don't care. That's not a motivator for them. But saying to them, oh, it's really bad for the planet when you collect all these medicines you don't need. It's just some people respond to that differently. But the outcome is good, regardless of which motivator they respond to.
Ooh,
Oh,
can't really see mine well because it's such a deep dish. Sorry.
It's okay.
all right.
You can do a photo later.
Yeah, you can take a photo.
Yeah.
Oh, it smells delicious.
It
I
does. smell
can't wait to
delicious.
have this with my Oatly custard.
Maybe I'll go buy some for after.
Yeah, you should. On the way to your doing your kitchen, you should get some Oatly custard.
Yeah. I'm tempted to just take a spoonful, but I think it might be too hot.
Yeah, so I took one of the pistachio nuts from the top, and it was quite.
And you were like,
I was like, oh, quickly. So, Liz, Katy, thank you very much for joining me for episode 5 of the Great Paediatric Bake Off. I think we've had a real in-depth discussion about climate change, and I will signpost our members and paediatricians to your working group and the website as well if they want some more information. Enjoy your apple crumble cake. Let me know how your team like it or your friends like it. I'm looking forward to having mine with some vanilla custard.
Oatly vanilla custard.
Oatly vanilla custard. Yes.
Thank you.
thanks, Ash. I can't wait to taste mine either. Cheers.
Yeah, bye. It was good fun.